As a daily question solving series, today I am going to start with orthopedics bone tumors. Okay, we will start solving the questions. X-ray shows the sun ray appearance suggesting osteosarcoma. So the young patient, the result can be made with because of the periosteal reactions. 10-year-old boy, swelling in the middle of the tibia, lytic lesion, sclerotic border. Diagnosis is first observe the age, 10 years, middle of the tibia, means diaphysis. So we shall go with the answer of okay. Where is the skeletal dysplasia invariably seen? Skeletal dysplasia is seen because of the developmental defects, not because of the hypothyroidism, osteosarcoma, and osteopenia. These are like first 1, 2, 3 are the bone weakness things. Fourth one gives the developmental defect. Identify the lytic lesion near the radius end. See, for this you have to remember this thing. Remember the mnemonic demo ECG. Diaphysis will contain mainly of Ewing sarcoma, metaphysis of osteochondroma, osteosarcoma, and simple bone cyst. Epiphysis containing of chondroblastoma and giant cell tumor. So mainly giant cell tumor. Patient complaining with the movement of the hand on extreme knee joint. See, this is the bone tumor involving the epiphyseal center. So the answer is diaphysis in a tibia, 5-year-old kid, pain and swelling will be there, ESR is raised. Observe the age, 5 years in the diaphysis of tibia. D contains E, Ewing sarcoma. Not a sign of malignant transformation. Pain, weight loss, increase in size, and increase in thickness of the cartilage cap. In malignancy, there will be weight gain, not the weight loss. Will increase in the size, pain will be there, thickness of the cartilage will be more than 2 centimeter. Fever, edema, periosteal response. What is the next stage of the patient diagnosis? So the edema is there. To see the periosteal response, which is not visible on X-ray, we will go with the MRI. See, again, it is involving the epiphyseal thing, bone tumor. Not a true giant cell tumor. 20 to 40 is the age group. Matrix containing the mononuclear cells. And osteoclast giant cells constitutes the proliferative component. No, the mononuclear cells will contribute the proliferative component. It is a benign tumor which may lead to the metastasis, most commonly lung. The biopsy of the sternum reveals red. Red means it involving the blood vessels, mainly hemangioma. Fallen fragment sign. Fallen fragment sign mainly involve the simple bone cyst. You can see here like this. This is fallen bone cyst, fallen fragment. Synovial sarcoma is false. It originates from the synovial lining. Yes, often lead to extra-articular sites. No, it involves the articular sites. Seen in less than 50 years of age, knee and foot, those are the synovial joints. So it is mainly involving those joints. Which of the following tumor causes hypoglycemia? Hypoglycemia is mainly caused by the fibrosarcoma or osteosarcoma. Mainly of fibrosarcoma it can be seen, because in fibrosarcoma You can see here, because of the insulin growth factor involvement, there will be increased production of insulin, leading to hypoglycemia. Brown tumor is because of the hyperparathyroidism, because of the fibroblasts. 30 years old, knee swelling and giant cell tumor and molecular cells. Again, see giant cells, GCT, knee swelling. Incorrect regarding the biopsy. Okay, always done by transverse incision and should be taken from two different plane. Yes. Should be taken after the radiological investigation. Yes. Specimen should involve the periphery, not from the necrotic center. Okay. First of all, we should take the longitudinal incision, not the transfer incision, and all three are correct. A male by 10 years of age, and see now, it is not involving the epiphysis, it is involving the metaphysis. So, according to this mnemonic, we shall go with MO. Osteosarcoma and osteoblastoma. It is a Codman triangle involving sunray appearance. It is because of osteosarcoma. See, in GCT mainly by the interstitial steroid can be involved. Simple bone cyst GCT mainly involves the treatment of curettage. So A4. Okay. C, simple bone cyst involves the wide local excision. So 3. A child has acute ALL. Okay. Acute lymphocytic leukemia. Okay, which of the following radiation exposure will be least severe? In this case, you have to see that which of the following cells which will divide less. When the cells start dividing, it will stop at one stage. Neurons are the things. Male patient, 30 years old. See again, involving the epiphysis, so it is osteoclastoma. Following radiology. Okay, see, you can see the onion like this thing around the bone. So it is nothing but the Ewing sarcoma. Tumor develops in the child epiphysis. You can guess by this thing, ECG. So which is involving C. A patient present with multiple swelling in the right hand suggests diagnosis of. See, these are the enchondromas, which can be seen in Maffucci syndrome also. Okay. X-ray film of the 22-year female. See, this is involving the epiphysis. So clear cut answer is GCT. Pain in the thigh. Okay, see this. Pain in the thigh, pain worsened at the night, relieved by aspirin. So which one of this? See, it is not involving the epiphysis, it is involving the metaphyseal region. So according to the mnemonic, MO. Okay, and we can rule out 1 and 2. Coming to 3 and 4 answer. 4. Osteosarcoma involves the Codman triangle sunray appearance, which is not seen in this option in this question. So the answer is 3. 14-year-old. See, this cartilaginous cap is found. To identify the malignant transformation, they asked. So for the malignant transformation, the hyaline cap thickness should be more than 2 centimeter, or equal or more than 2 centimeter. See, cartilaginous cap, again 17 years old boy, involving the chondroblastoma. Osteochondroma, sorry, okay. And coming to this, involving the epiphysis, giant cell tumor. Again, cartilaginous cap involves the metaphyseal region, It is osteochondroma. Complaints of progressive swelling around the knee, so around the wrist, involving the epiphyseal center. So it is nothing but osteoclastoma, a giant cell tumor. Okay, thank you guys.